Welcome to the deep dive. Today, we're tackling something really important, a role that takes incredible strength, being a caregiver for someone battling cancer.
It really does. It's born from love, obviously, but, well, most people aren't really prepared for the practical side, the day-to-day stuff.
Exactly. So if you're stepping into this role, maybe feeling a bit overwhelmed, think of this deep dive as like your essential toolkit. We want to give you a shortcut to those core skills, the hands-on things you'll likely need to do. Simple, practical instructions.
And it's interesting, isn't it? Mastering these sort of basic tasks, it's not just about keeping your loved ones safe, though that's huge. It builds your confidence, too. The emotional support is number one, of course. But the practical care, that's built on safety, patience, careful observation.
Yeah.
And you absolutely don't need to be a nurse. Feeling uncertain, totally normal. We just want to demystify things a bit so you can worry less about the how-to and focus more on that invaluable comfort.
That's a great way to put it, building that base. Okay, so speaking of bases, safety first, right? Assisting with mobility. And the big one there is preventing falls, especially for older adults with cancer.
Oh, absolutely paramount.
Yeah, because it's not just a little slip. A fall can be genuinely devastating. We're talking fractures, hospital stays, and things that can seriously delay their cancer treatment. That's the last thing anyone needs.
Exactly. Huge consequences.
So before you even get to, physically helping someone move, the very first step is the environment, making their space safer.
Precisely. That's job number one. And thankfully, a lot of it is, well, common sense stuff, but you have to be intentional. First, clearing paths. Look at the main routes, bed to bathroom to their favorite chair. Get rid of throw rugs. Seriously, they're a major hazard.
Right, cords too.
Cords, clutter, stacks of anything. Just clear those walkways completely. Imagine navigating it if you felt a bit weak or unsteady.
Makes sense.
Second, lighting.
Yeah.
Good, bright lighting everywhere, especially hallways, bathrooms, and definitely at night. Add night lights. Vision can change. Treatments cause fatigue. Good light helps.
Okay.
And third, footwear. This is a big one. Non-skid slippers or socks with grips.
Not bare feet or those loose slide-on slippers.
No, definitely not. Bare feet, no protection. Loose slippers, they can just slip right off. You need that grip, that traction. It's all about stability.
Got it. So clear paths, good light, groovy footwear. Simple stuff, you have to actually do it.
Exactly. Proactive steps.
Okay, so the environment's prepped. Now let's talk about actually helping someone move, like standing up from a chair. Body mechanics are key here, right, for everyone involved.
Absolutely. Protect your back, protect them.
So for the person sitting, you want them to scoot right to the edge of the chair first.
Yep. Feet flat on the floor, about shoulder width apart, gives them a good base.
And for you, the caregiver, how should you stand?
You stand right in front, facing them. Feet staggered, one slightly ahead of the other. Nice, stable stance. And crucially, bend your knees and hips. Keep your back straight.
Use the legs, not the back. I hear that a lot.
Always. Your legs are strong. Your back isn't designed for that kind of lifting.
Okay. And what should the person sitting do with their hands?
They should put their hands on the armrests of the chair, ready to push up.
So they shouldn't grab onto my neck or shoulders?
No, absolutely not. That throws everyone off balance. It's a really common mistake, but dangerous. They push from the chair.
Okay. And where do my hands go?
You can put your hands around their back, kind of under the arms for support. Or even better, use a gait belt if you have one. Give you a really secure hold around their waist.
Right, a gait belt. Good tool. Then what?
Then you communicate. Say, okay, on 3 we'll stand. 1, 2, 3. As they push up with their arms and lean forward slightly, you guide their momentum up using your leg power.
And once they're up, just let them go.
No, wait. Crucial pause here. Let them stand still for just a moment. Let them get their balance before they try to walk. People often rush this.
Ah, that pause. Give them a second to adjust.
Exactly. It's surprisingly important. Same idea applies to getting out of bed. That's often when folks feel weakest.
Right, makes sense. So how do you help with that?
First, have them bend their knees while they're lying on their back. Then help them roll onto their side, facing you. You'll be standing beside the bed.
Okay, roll to the side.
Then help them swing their legs over the edge of the bed. As their legs go down, their upper body will naturally start to come up.
Right.
You support their shoulders and back as they use their arms to push themselves up into a sitting position on the edge of the bed.
Okay, sitting on the edge, then the pause again.
Yes, the 30-second rule. Have them sit there for at least 30 seconds before they even try to stand up. Check for dizziness.
Right, that head rush feeling. Why is that pause so critical here?
Well, you know that feeling, right?
Oh, yeah.
Go from lying down to sitting or standing too fast, and whoosh.
Yeah, definitely.
For someone weakened by cancer or meds, that whoosh, that drop in blood pressure when gravity pulls blood down, isn't just unpleasant. Their body might not compensate quickly enough.
Ah, so the system is sluggish.
Kind of, yeah. That pause lets their blood pressure stabilize, lets the body adjust before they put weight on their feet, prevents dizziness, lightheadedness, even fainting. Doctors call it orthostatic hypotension.
Orthostatic hypotension. Got it. So that 30 seconds is a real safety buffer.
It truly is. Prevents a potential fall right at the bedside. Okay, so we've covered moving safely. Let's shift gears a bit to hygiene.
Right. More than just being clean, isn't it?
Oh, much more. It's about preventing skin infections, painful mouth sores. They're also dignity. Feeling clean makes a huge difference to someone's well-being, especially when they're feeling vulnerable.
Absolutely. So bathing, does it always have to be a full shower or bath? That sounds exhausting.
Exactly. Often, it's too exhausting or just not safe. A sponge bath, either in bed or just sitting in a sturdy chair, can be just as effective and much less taxing.
Okay, good to know. But if a shower is possible...
Safety first, again. A shower chair or bench is pretty much essential. Lets them sit down, saves energy, reduces fall risk.
Makes sense. And a handheld shower head.
Highly recommended. Makes rinsing easier, more controlled. Also, non-slip mats inside and outside the tub are crucial. Grab bars installed properly. Even better, wise investments.
Okay. And what about like soap and water temperature?
Lukewarm water, not too hot, not too cold, and use a very gentle, unscented soap.
Why unscented?
Skin can become incredibly sensitive from treatments, especially radiation. Perfumes and harsh chemicals can cause irritation, rashes. Gentle is key.
And drying off, just rub with a towel?
No, never rub, especially over any areas getting radiation. Just gently pat the skin dry with a soft towel. Rubbing can damage fragile skin.
Don't rub. Got it.
And while you're helping, this is a prime time for observation. Look at their skin. Check for any redness, rashes, sores. Pay extra attention to skin folds, underarms, groin, under breasts, and bony spots like the tailbone, hips, heels.
So hygiene time is also skin check time, catching problems early.
Exactly. You might spot something before it becomes a real issue, like a pressure sore starting. Small observations can prevent big complications.
That makes perfect sense. Okay, another area that sounds small but is actually huge. Oral care, mouth care.
Hugely important, often overlooked. Cancer treatments can really wreak havoc on the mouth, making it super sensitive.
Right. And good care prevents things like mouth sores, mucositis.
Yes. Painful sores, infections, stuff that can actually get bad enough to delay their cancer treatment. So it's critical.
Okay, so what's the drill? What tools?
Extra soft toothbrush. That's non-negotiable. You can even soften the bristles more by running the brush under warm water before using it.
Extra soft. Gentle technique, too.
Very gentle. Brush after every meal and at bedtime. Light pressure.
Toothpaste, any kind.
Use a fluoride toothpaste, that's good. But definitely avoid anything with whitening agents or really strong flavors like intense mint. Too harsh, can burn or irritate.
Okay, mild fluoride paste. What about mouthwash? Those strong antiseptic ones?
No. Avoid alcohol-based mouthwash completely. Alcohol's very drying, makes sores worse. Big no-no.
So what can they use for rinsing?
Actually, simple homemade rinse is often best. Super effective and gentle. Mix 1 teaspoon of salt and 1 teaspoon of baking soda in about a quart 32 ounces of warm water.
Salt and baking soda?
Yep. Have them swish gently with that mixture and spit it out several times a day. It cleans, moistens, reduces bacteria, all without irritation.
Wow. Okay. Simple. Salt, baking soda, water.
And one last thing for oral care. Lips. Keep them moisturized with a plain, unscented lip balm. Prevents cracking, which can be really uncomfortable.
Right. Those little details add up.
They really do. It's like comfort in preventing complications.
Okay, so we've talked about physical assistance, hygiene. Now let's talk about maybe the most powerful role you have as a caregiver, being a keen observer.
The eyes and ears on the ground, basically.
Exactly. You're the front line. You see the subtle changes first. And reporting those changes promptly can stop a small problem from snowballing into a big one. You're a vital partner to the medical team. Okay, so what are we observing? Let's start with something basic. Temperature.
Right. You need a reliable digital thermometer.
Yeah.
Easy to use. And here is the absolute critical point you must remember. For many cancer patients whose immune systems might be weak, a fever is a medical emergency.
Okay. What temperature counts as a fever in this case?
Call the oncology office, the doctor or nurse immediately if the temperature hits 100.4 degrees Fahrenheit, which is 38 Celsius, or higher. Don't wait.
100.4F or 38C. Call immediately.
Got it. What about giving them Tylenol or ibuprofen to bring it down first?
Ah, good question. And the answer is critical. Do not give them any fever-reducing medicine unless the doctor specifically tells you to.
Really? Why not? Isn't bringing the fever down good?
It sounds counterintuitive, right? But think about it. The fever is a signal. It's the body's alarm saying infection or problem. If you give medicine that masks that fever.
Ah, you silence the alarm. Exactly. You hide the key symptom the doctors need to know about immediately. It can delay them figuring out what's wrong and starting the right treatment. So your job isn't to treat the fever, it's to report it accurately and fast.
Okay, that makes sense. Report, don't mask. What else should we be tracking closely? Pain.
Yes, absolutely. Pain is considered a vital sign now, just like temperature or blood pressure. It's subjective, but it's real and needs managing.
So how do you track something subjective like pain?
The simplest way is the 0 to 10 scale. Ask your loved one regularly. On a scale of 0 to 10, where 0 is no pain and 10 is the worst pain imaginable, what's your pain level right now?
Okay, 0 to 10, and just ask them that.
Ask regularly, and this is important, keep a little log, a small notebook. Write down the date, the time, their pain score, and maybe what they were doing or what medication they took and when.
Why keep a log?
Because that log is gold for the medical team. It shows patterns. Does the pain spike at certain times? Does the current medicine actually work? For how long? It gives them concrete data to adjust pain management effectively. Way better than just saying it hurts sometimes.
Right, gives them a clear picture. Okay, so temperature and pain are key things to monitor and report accurately.
Definitely. And that leads us to the big question. Besides fever, when else do you need to pick up the phone and call the oncology team right away?
Yeah, what are the other red flags?
Okay, here's a quick checklist of things that warrant an immediate call. Shaking chills. That often goes with fever and signals a bad infection.
Skin chills. Okay.
Any new pain or pain that's getting worse and isn't helped by their usual pain meds,
Or worsening pain.
shortness of breath, or any difficulty breathing, it's always urgent.
Breathing issues. Got it.
Any new confusion, sudden dizziness, or if they're much harder to wake up than usual, could be neurological.
Confusion, dizziness, hard to wake. Okay.
Frequent vomiting or diarrhea, they can get dehydrated really fast.
Vomiting, diarrhea.
If they can't eat or drink anything for more than, say, 24 hours, again, dehydration risk, lack of nutrition.
Can't eat or drink.
And finally, any new rashes, unusual swelling, or any bleeding like nosebleeds, blood in urine or stool.
Rashes, swelling, bleeding. Okay, that's a clear list. Why is calling immediately so vital for these things?
Because in someone whose system is already stressed by cancer and treatment, these things can escalate fast. What seems minor can become serious very quickly. Prompt communication allows for proactive management, catching things early before they become big crises. Early intervention makes a massive difference.
Wow. Okay. That really underscores the importance of paying attention and speaking up. We've covered a lot of ground here.
Really have.
From making the home safe to the actual techniques for helping with movement and bathing to that crucial mouth care, and then becoming that vigilant observer, watching for fever, pain, all those red flags. These skills we've talked about, they're the tools of the trade for a caregiver, aren't they? They give you something concrete to do, gives you confidence.
Absolutely. It empowers you. It moves you from feeling helpless to feeling helpful, capable. And remember, what you're doing when you provide this care, it's a deep, profound act of service. It really is. Performing these tasks, clearing the path, helping them stand safely, gently washing their skin, carefully checking their temperature, doing it with care and attention, you're giving them a powerful kind of medicine.
Well, a medicine of safety.
Comfort, exactly. The medicine of safety, comfort, and just unwavering support. Knowing someone is there, reliably, carefully looking out for them. And maybe here's something to think about. We focus a lot on the practical, the tangible skills today. But consider this. What does it really mean to offer unwavering support when this whole journey is just so uncertain? How does getting comfortable with these physical tasks, mastering these basics, how does that actually free you up? Does it allow you to provide maybe even deeper emotional comfort, knowing the practical side is handled, something to reflect on as you navigate this role?